Once the cell begins to die, the body becomes vulnerable. From 26 to 50, at that point in time, the body metabolism are no longer as strong as in your vibrancy. There'll be a little opening. Bad cholesterol will be injected into the bloodstream. Once this is happening, there is no any sign or symptom one can relate to, or soon or later the blood becomes viscous. Blood viscosity is a situation whereby the blood is supposed to be as watery as water, now is thick. And once the blood becomes thick, the heart that pumps the blood will find it very difficult to do its civil responsibility. It has to stretch beyond the normal range. While that stretch is taking place, it's going to deteriorate the sixth zone, and that's why I see people from 55 there about have some kind of complication here and there. But right now in this zone, the China vein may not be receiving adequate supply. Why? We all know needles, right? Needle. We know needle, you need to use a local sewing, and we know thread, and we know rope. If you use rope to access the eyes of a needle, will you get access? Will you?
No.
Because of what? Thickness, right? The process in which the blood goes to the vessel are more tinier than the eyes of a needle. In the situation whereby the blood becomes thick, the China vein may not be receiving adequate supply. And once they're not receiving adequate supply, what happens to them? They begin to die. As they die, they're going to multiply. Once they multiply, they failure in this scenario, develop some kind of illness. After a long battle, if it's lucky to survive it, you'll find a part of the body is gone. We call it partial stroke. And it may worsen. Why? Because myocardial blood supply is going to be insufficient. That's the channel in which the energy also goes to the brain is going to be minimal. When this is happening, sometimes you begin to have kind of much forgetfulness, but in most cases, one begin to have what we call heart failure. Heart failure is not as if one is stopped breathing, it's ongoing chronic diseases that is deteriorating the system within the time period, waiting for a trigger. Let me put a character in this scenario so that I can see it more better. Imagine somebody has been working towards achieving his target. Yes, the target. Now, imagine I've been working towards it for the past 6 months, for the past 1 year. The guy actually actualized the day for yesterday. The guy was promoted day for yesterday. He drove himself home last night, only to wake up this morning to hit the bathroom. The guy slept on the floor. The guy wasn't standing. The family member realized something wrong with the fellow. They rushed into the hospital. The first day, the second day, the third day, the guy's not responding to treatment. What do you think the family member will be thinking at that point in time? He was promoted day before yesterday. He drove himself home last night, only to wake up this morning. He slept on the floor. He's not standing after 3 days. What do you think the family member will be thinking? This is Africa. This is Africa. But in reality, this is why the whole thing differs. Believe you me, if you wake up with any alignment, any pains, anything, even though you fought the winch last night, don't conclude that person has been winching. Because many a time, many people conclude they will take the fellow to wrong places. When the guy is about to die, they will return to the hospital. At that point, what can doctor do for someone? So in reality, exceed all the proper process of medication before you conclude. When you realize you're not getting results, before you supplement. When we kids, something happened, and I use this example almost every day. What happened? We usually go accompany our parents to the market. So one of us, have our own crew, our mate. One of us was complaining feet pains. He couldn't even walk fast. The following day, we couldn't go to the market. We went to check him out. The third day, this guy was lying there helplessly. The cutting with sharp object, the rope all kind of mixture. Oh, trying to find out what's actually wrong with him. The mother said the guy stepped on the child. Then we're 15, 16 years about, we could not even reconcile it. Now, after 1 week, the whole thing deteriorated. The guy could not stand, he can't see, he can't do anything. They take it to the washroom, they're washing, they clean, they return it every day. 16 years, when the father could not reconcile it, the guy is getting paralyzed. The guy had to sneak the child to the hospital. Why is the father sneaking the child to the hospital? Because the mother have made a conclusion that the guy has been bewitched. 3 days later, after injection, this guy wake up, started doing things by himself. The whole thing looked like a miracle. When they went for the last injection, the father was asking the doctor, what's the problem? The guy had rheumatism excessively. All the bones, any joint that human being have in the bone, the tumor has already deteriorated. The guy is about to die. And the doctor said, even if it lasts more 3 days, the guy will have died. But if I told the guy died after 3 days, who will be crying? The mother will be thinking somebody be reaching from the village, why she's the one responsible. So the guy that bring about this scenario, what happened to him? Saturated fat succeed in closing the vessels. And how do we get saturated fat? You're the one using your hand and money to buy them. And when they are closing your vessel, there is no sign, there is no symptom. Now the guy that was promoted, what happened to him now? He fall down, the body has been looking for trigger. That falling down destabilized the body metabolism. The trigger was looking for was gotten. What happened now? The heart gets ruptured, the brain gets damaged, the connectivity between the brain and the spine get disconnected, one come down, total stroke. How do we get it? Saturated fat. Where do we get them? You buy them. You go to market sometimes, you see oil under some freezing. You use them consuming them. You see one thing with adult, after taking your last meal, what happened? You're sitting on the couch before you know it, you're on the bed. Now, what happened? If that food have deposit of cholesterol, bad oil, the crumbs of it are coming into the body, and these chronic diseases are not something specific. They are combination of accumulation that deteriorate the system over time. And when these things are coming, just imagine that fellow that just been promoted, lie there in the hospital now, he's not talking, he's not moving. The family member believe he's been bewitched, but he's not been bewitched. It's because of saturated fat. That is why the World Organization, CDC, Center for Disease Control Prevention, Scientific Advisory Board, they are the worldwide network of scientists who projected long before now. They say from 2020 downward, out of every 4 deaths, 3 is because of chronic diseases. As you are sitting here now, did you know about liver, kidney disease, arthritis, cancer, diabetes, or stroke? When they realize the situation is going out of hand, once you become a victim, one will remain under medication for the rest of one's life. So what are they going to do to control the situation? They go back to the drawing board. They say, if you want to live 70, 80, 90, maybe I should slow down. If I ask this question, how many of us want to live 70, 80, 90, even condo, without liver, kidney disease, arthritis, cancer, diabetes? Somebody say all of us. But there's nothing for all of us. There's a little responsibility attached to it. And many people cannot discipline themselves in this regard. It's like drinking water from the glass. They say if you want to live 70, 80, 90 without no deficiency, first of all you need to do physical exercise. You heard that countless times, child without number. But what happened around this neighborhood? I'm a banker. I wake up early morning. I don't have all the time. But one thing you don't understand is that from Monday to Friday you're not sweating. All the junk, all the food you're combining, they are storing somewhere. So in reality, if you woke up in the morning, 6:10, 6:15, at that point in time, the body metabolism is not expected to be heated. By the time you do some kind of exercise, the bad cholesterol will be leaving the body naturally. 10 minutes of exercise allow the heart to release a certain chemical reaction that purify your heart and strengthen your organs. It's a win-win situation. If you're not exercising, you're cutting 10% out of the last part. I was talking about cardiovascular diseases. Imagine as you're all sitting here now, God forbid back team, something chased all of us, 20 minutes, back to back. How many of us are sure to save your dear life? When's the last time you did that? The last time immigration were having screening, what does it entail? Going before some of them run 10, 15 minutes, they're vomiting, falling, vomiting blood before the rush to the hospital, but no, they actually die from cardiac arrest. So what I'm trying to say is that you should endeavor to do exercise. You don't need money to do exercise 2-3 times in the week. On Saturday, on Sunday, if you cannot do jogging, you walk. If you're not doing this thing has turned the body. When they are coming like monster. You will never believe it's from what you're consuming. Whatever excessive drinking, you are here from Monday to Friday. There is no sunlight. You take excessive cold water. When you come in bed with cold water, you see some people on the wheelchair, most of them never have accident. For osteoporosis, rheumatism, arthritis, and now they end up in a wheelchair. So if you want to live healthy, 70, 80, 90, in fact, go to find out what of lack of exercise to the human nature, you'll find over 54 chronic diseases that you imagine from just lack of exercise. The next one, they say, when they live 70, 80, 90, you need to rest. How many of us know how to rest anymore? How many of us actually resting? Do you rest here? No, in your place at home. How many hours do you sleep at night? Sleep is the only thing that consoles the human soul. When you are not sleeping, then you are depressed. And when you are depressed, depression leads to what? Nothing but early death. I was reading one scripture. I heard God was telling his messenger. He said, do you want to kill yourself over them? Do you want to grieve with sorrow and distress and kill yourself because of this? What is he trying to tell him? Grieve, distress, sorrow can kill you. That mental picture you are visualizing. If you keep on distressing yourself overnight, you cry on the bed, you can't sleep. Oh my God, have they been a shooter? You're living in yesterday, day for yesterday. Oh my God, have they been a shooter? You're dying gradually. And that's why you see many times when people begin to thinking and stress is the cause of high blood pressure. Because when you're thinking excessively, your blood begins to flow in the normal range. When you are not lucky, when you bounce back, you wake up in the morning and see the fellow with the blood stain in the mouth, the guy is gone. They say it's been bewitched. You kill yourself. Lie down, think about things that excite you. If those moments are not coming, I say even the devil, there was a time was an angel. That was the most beautiful moment of his life. Everybody have the most beautiful moment of your life. If it's not coming down low, you have phones. What are you using your phone for? I was listening to one yesterday. It's so beautiful that I want to listen and sleep is taking over me. At the point how to off it. If it is no beautiful thing you love, no matter the stress, no matter the pain, sadness, and frustration, so long you love those things, you can shut down. And when you wake up in the morning, it's as if you resurrected from the land of death. That's why your brain can incorporate. If that is not happening, you begin to have memory index. As you're going older, you're going to have memory damage. You need to shut down. Think about beautiful things. What of fantasy? Those time in university, there's a time you are having that joy. If you don't do that, you're putting 10% out of the last one. The next one is when you live 70, 80, 90, you need to do constant routine checkup. The World Organization said the food you're consuming is the problem. The only way you can know what to do, you detoxify and purify. How do you detoxify and purify? They say check to know how the organs of the body are functioning. At least 3 times in a year, we say this is Africa. Check once to know how the body are functioning. Because what you're consuming is the problem. If you don't detoxify and purify, the possibility of accumulation is going to be there. And once you accumulate, you deteriorate the system completely. What about prostate cancer? It's associated with the age for the men. If you're wearing tight, if you know any man that wear tight or you wear panties or you wear tight boxers, advise him that he's gradually killing himself. Because if you wear too much of tight things, your body is generating too much of heat, and you have an STD that's not well taken care of. When they come together, they pay going for prostrate. And when that happened, there was one Nigerian movie actor that was diagnosed some time ago with prostate cancer. They gave this guy an option that's never option to anybody. They say, after undergo the surgical operation, there's a tendency you may not make it alive. Make it alive, become an impotent. If you don't want that to happen, you should be injecting yourself with a vaccine that will cost you 120,000 every 30 days. Times that the next 10 years, you definitely want to be alive. What about the women? Pelvic inflammatory diseases. As you're sitting here now, if you go back to memory lane, can you remember any woman around your neighborhood when you grew up that's not giving birth to children? When you're growing up, you hardly find one. But as you're sitting here now, you have neighbor, cousin, nephew, maybe colleague around this neighborhood now that got married for the past 3, 4, 5 years. No issue. When they return from the hospital, what do they tell us? Doctors say toilet infection is responsible for blockage of their fallopian tube. Is that really true? 10% true because of human invention, and 90% because of Legis genes heat. We call it Legis genes heat infection. For a woman that wears too much of genes and Legis, you don't need a lot to practicalize this. Your body needs more of air. That's why 3, 4 decades ago, those women of that generation, they don't have problem with this child or all this kind of thing that people are having in this generation. How the women of this generation dress, you know yourself. What you do, you wear panties, you wear tie, when the shape is not coming, I wear some boxer before I wear the jeans. Where you going? Are you going for war? The body is cooking. As the body is cooking, as the body is cooking, one class please. As the body is cooking, one thing you don't need a lot to practicalize this. If you wear trousers and you go home, when you pull it, please, what kind of odor do you perceive? Is it friendly? Is that how you smell? No. Your body is cooking, it's trying to relate to you negatively. Soon or later, you begin to have what? Inches. Before you know, rashes. Before you begin to have discharge. Sometimes you feel messed up, untreated, mistreated. Infection can block one fallopian tube for life. And women, when you're having this, sometimes you can even tell your friend, look at what I'm saying. You're talking to help matter to a mechanic. He cannot understand. She can only tell you, oh, even me, there was a time it was like that. Let's just imagine you started with 21. When you're 31, you got to marry. 10 years, there's infection in your body. 1 year, 2 years, after 3 years, 4 years, 5 years, you marry, no child. You begin to spiritualize this whole matter. For a woman want to live healthy, to bear children, don't wear too much of tight clothes. The 10% of toilet infection, some women, I was diagnosing a lady the other day in one presentation. At the end of the day, I see her gynecologist was messed up. Yeah, what's the problem? The same and clean, nothing's wrong with me. Are you feeling this? Are you feeling this? Yes, but I don't know the cause. Do you sit on the toilet for a long period of time? She say, yes, that place is my home. Don't even go about it. Now, this is true. Some people sit down on the toilet, say, writing